good.
Thank you very much. Hi, good afternoon, esteemed excellencies and audience. My name is Ariel Beery. I'm the co-founder and CEO of MobileODT. When someone in New York gets sick, they'll go to a doctor, and they expect the doctor to do two things. First, for the doctor to listen and hear what they're complaining about. Maybe their elbow hurts, or they have a rash, or their eye is pink. And next, what the doctor does is looks, and based on what that doctor sees, she'll make a decision, either to prescribe a medicine or send that person to a physician who can help provide them the care that they need in order to get well. But as you excellencies know better than anyone, for 5 billion people around the planet, there is no other doctor. And the person at the point of care, despite being a wonderful public servant, is often challenged by lack of education and lack of resources. And so what my company does is it transforms the supercomputers we all have in our pockets, these mobile phones, into powerful medical devices. This is called the Enhanced Visual Assessment System. What you're looking at has the same power of a medical device 10 times the size and 10 times the cost. But because of the phone, it's infinitely smarter. Thanks to the app, what this enables a health provider to do anywhere in the 22 countries around the planet in which we work is to enable that nurse to examine a patient at the level of an expert practitioner. And most importantly also for the ministries of health and other supporting organizations to support that nurse at the point of care. And we decided to start the deployment of this in cervical cancer. As many of you know, cervical cancer, a woman's disease, is the leading cause of death for women across the continent. It's a disease that affects the outside of the uterus. And the most tragic thing is that it's a disease that can be treated on the spot for less than $25 in a single setting, if only it's caught in 5 years from its beginning. So why are so many women dying of a disease that it's so easy to treat? Well, it's because across the continent in Africa and around the world, in Latin America and Asia, the only way for a woman to be detected for cervical cancer is with the naked eye. And that's what we're here to change. So this system not only enables a health provider to be able to screen her patients using a system that she knows so well, to view the woman's cervix at magnification and illumination, and to capture images of that session to transmit to experts that can provide support, but also to receive the support of algorithms that can assist in the decision-making. And we go beyond that. It's not only assisting that patient at the point of care, it's also enabling the ministries of health, governments to know how many women have been screened, where have they been screened, what's the breakdown of disease, and how can we address that from a policy level. And we go further to look at statistics. How did that nurse do on that particular day? And can we support her and help her to ensure that she receives the education, the training, and the resources she needs? And then beyond just the nurse, the patient. We enable the provider and the Ministry of Health to contact that patient through her phone, through SMS, and help her to get the care she needs so that the leading cause of death in Africa can become a past of our history. We've been fortunate to work with health providers from the leading institutions around the planet and to be accepted in many countries across Africa. We look forward to working with you to end cervical cancer in our lifetime. Thank you.